Hi everyone, Dr. Mika here again. If you're new on this channel, welcome. Please click on the subscribe button. Turn on your notification bell so that anytime I drop videos, you'll be notified. Like and share this video, please. Subscribe. So today I'll be talking about stroke. Yes, you heard me right. I know you've heard of stroke. I know that you've read about stroke. But in this video, I'll be discussing about stroke. The word stroke comes from receiving a strike or a blow, a sudden blow in the brain this time around, just in the brain, a strike in the brain. So the individual will come down with this illness called stroke. There's a report from the US that says more than 15 million people annually across the world have this strike or stroke yearly. So the statistic is that 5 million people usually die from this stroke, while the other 5 million are left disabled. Then the rest of the people are those who are very fortunate and made it to the hospital early, present themselves and then get treated, receive adequate treatment, and then have a full recovery from this attack. Oftentimes, people talk about stroke as if it affects only elderly people. No, stroke also affects young population. So if you're a young person watching this video, just have it in mind that stroke also affects young people. So, but what is it about this stroke thing? The brain, like every other part of the body, receive or requires oxygen to function, and the oxygen it receives is from the blood. Okay, so when the oxygen supply to the brain is cut off, the individual will have stroke. That is how you have stroke, because the cells in the brain will be damaged, okay, and the individual will come down with stroke. So depending on which is which, the stroke usually affect different part of the brain. So if it affects the frontal part of the brain called the frontal lobe, the presentation of the patient, the signs and symptoms will be different from when it affects the parietal lobe or the temporal or the occipital part of the brain. So depending on the area of the brain, because the brain itself controls the body. So each part of the brain has its functions. So when there is a strike or a stroke in that part or that location of the brain, the presentation of the patient will be different. Okay. Sometimes they have confusions, lost speech, facial paralysis, and all that. So, do you like what you're watching? Please click on the subscribe button. So, it is very important when you notice some of these features that you swing into action, because time is of essence when it comes to stroke. You act fast. Fast means F stand for check if the individual has facial paralysis on one side. Okay, if the person is able to smile or not, that is one red flag. Secondly, A, check if they have arm paralysis. Ask the individual to raise both arms up. If the individual is not able to raise a particular one arm up, then that's another red flag. S, check if they have slow speech. The person is not speaking the way he or she used to speak. That's another red flag. T is time. Time is of essence in stroke. So that is why I say act fast. The fast are those four-letter words: F, A, S, and T. When you notice this red flag, take the patient to the hospital immediately or call an ambulance. Take the patient to the hospital. The moment you arrive at the emergency, there's always a doctor at the emergency to receive the patient. The doctor will assess the patient and request for an urgent head CT scan just to check for which location of the brain is damaged. And then they will start or commence the treatment. Stroke are grouped into two depending on the problem. uh, in the blood vessel supply. So it can either be ischemic stroke or hemorrhagic stroke. Majority of the blockage stroke, about 85% are blockage stroke. And this is why it's very important to, identify which of the stroke that has happened early enough, as each of the stroke has its own treatment. So that the doctor can, tailor down the treatment of the stroke depending on which is which, either if it is ischemic or hemorrhagic stroke. But the one that is more in terms of patient presentation is the ischemic stroke. So blockage stroke are commonly caused by buildup of fatty materials in the blood vessels. So this fatty material that is built up will cause a clot, okay, that will block the blood vessel supply to the brain, just like in the case of heart attack as well. This is why stroke is also referred to as brain attack. Clots may occur within the brain sometimes, or can even travel from one part of the body to another, especially within the blood vessels that is on the neck. Okay, and sometimes clots can also equally travel from the heart, okay, even to another part of the body. Just in case of a patient that have irregular heartbeat or what is called atrial fibrillation, okay, such patient can have the blood travel from the heart to another part of the brain. So when a stroke happen like this and the individual is rushed to the ER or to the emergency department, there is what is called thrombolysis that is given to the patient. This thrombolysis help to burst the clot. It helps to burst the clots that forms. Okay. So, but when there is no thrombolysis, they can equally give aspirin. But if the patient is brought into the hospital, most hospitals, especially teaching hospital, have this thrombolysis. As soon as the patient comes, a CT scan is done to determine the area of the brain that is damaged. Next thing is to give the patient the medicine that can burst the clots, which is the thrombolysis, or they can give aspirin in either case. So bleeding stroke happen when the blood vessel suddenly bursts, okay, causing blood to leak around the brain. In this stroke, blood around the brain can lead to swelling, which may require surgery sometimes. Sometimes stroke symptoms can suddenly disappear in less than 24 hours. This is called a mini stroke or a TIA, transient ischemic attack. The symptoms also happen or appears like a full-blown stroke, but it is not. However, it is important to go to the hospital immediately after experiencing a TIA or a mini stroke. The reason is that a TIA is a warning sign that you are likely going to have a full blown stroke. So it is important that even if you have a sign of a TIA or you had a mini stroke, it's important to go to the hospital. Don't say, oh, I'm fine or whatever. No, go to the hospital for proper checkup so they can either place you on aspirin for a long time to, prevent you from having a full blown stroke, because that might be disastrous. So if you experience anything like this, please immediately visit the emergency to see a doctor. The effect of stroke can be very challenging, but if the brain is given a little chance, it will slowly recover its lost abilities. And this is why for stroke patients, rehabilitation is very, very important. You know, although rehab can be very challenging, but a number of specialists are now involved in this patient management alongside doctors and nurses. If a patient have problem of swallowing after stroke, there are dietitian who comes around prescribe, draft out the diet for the patient, and sometimes they advise that patient should be having feeding tube. Okay, if patient has a problem with communication after stroke, there are language therapists, okay, who comes to help patients. And if patient have difficulties in walking after stroke, we have physiotherapists, occupational therapists who will come and draft out different exercises and assist the patient in carrying out those exercises most times. And even home adaptation as well. They help the patient with home adaptation because stroke can be very frustrating, especially for individuals who are independent. When they have stroke, they now have to depend on people, and it can be very frustrating, such that they will have low self-esteem. They might even enter depression sometimes, and that is why it's important for them to speak to a counselor. So there are counselors who help them by talking them through this particular phase, because it can be very, very challenging and depressing for patients that have stroke, especially those who are very used to being independent. Yeah, so we've talked so much about stroke, but the question is, what can we do to, prevent it from happening again? Or even if you already had stroke, what can you do to stop it from reoccurring? Okay, first, you lower your high blood pressure. As high blood pressure is number one cause of stroke, high blood pressure is number one cause of stroke. Secondly, you stop smoking. Stop smoking. Thirdly, you lower your cholesterol level. Fourth, be involved in active exercise. If there are no place where you can be involved in exercises, then go to the gym. Another thing you have to do is eat healthy. Eat healthy. Don't just eat, but eat healthy. Okay? And also, if you have diabetes, please monitor your blood sugar. It's important that you do that. In my next video, I will discuss in detail about ischemic stroke and hemorrhagic stroke, so you know the difference between all these strokes. I hope you enjoyed this video. If you do, please just click on the subscribe button. Just click on it. All right? Thank you for watching. Atutale.